Okay, Yusuf, we can get started.
Can you hear me? Can you see me?
Yes, we can hear you and we can see you.
Thank you very much, Felix. So, good morning, good afternoon, ladies and gentlemen. Really nice to have you today again. I am Dr. Yusuf Baptiste Kanute, Technical Officer at WHO HQ within the EOC team. I'm really glad to be the moderator of our today's session, which is the second webinar in this series on logistics and the supply chain management during emergencies, and especially within the PHEOC environment. As you all know, it's in complex public health emergencies, the resources are always inadequate, never enough, and the demands for resources and logistics are endless. We are lucky today we have the chance to further explore this crucial topic with our expert, Nolin Okesh from Africa CDC. Nolin, as a brief introduction, Nolin is a logistics and procurement officer for COVID-19 response in Africa, working at Africa CDC. Nolin will take us today through her presentation on resource management for about 30 minutes. This will give you enough time for another 30-minute Q&A discussion to share your opinions, comments, suggestions together and discuss them here. In addition to Nolin, we have in the panel our colleague Felix Ingabire and Womi, who will support me during the Q&A portion. Ladies and gentlemen, before we start, some simple routine reminders. just remember that we have a French translation service that is made available for you through this Zoom platform. So feel free to click on the translation button at the bottom of your screen to access the French version of the discussions. We also encourage you to use the Q&A box on your screen and drop your questions. We will be really excited to hear from you and discuss your questions during the Q&A portion or later on the Discord platform. If you have not already done so, please join the PHEOC community of practice on the Discord platform. This will be really helpful for you to keep continuous engagement and experience sharing with our experts. You have the link to the Discord platform that Felix will send to all of you in the chat box during the webinar. At the end of the webinar, we will also send you a short survey still to gather your experience and your comments about today's session. So you are really encouraged to take this survey, respond to the questions. We value your feedback as it will help us to continuously improve the quality of the webinar and the quality of future sessions. Nolin, if you are ready, the floor is yours. Please take us through your presentation.
Okay, let me kindly share my presentation.
Wami?
Okay, so today we are going to talk about resource management. And I'm Nolin Mandokech, a representative from Africa CDC. Next slide, please. So the purpose for this webinar is to talk about the objectives of resource management and resource typing and readiness. So we'll have to understand what resource management is and what resource typing readiness is. That's my outline for today's webinar. Next. So the objective of this webinar is that at the end of this series, participants should be able to understand a few things. One being, provide an overview of the roles and responsibilities of the logistics section in preparedness for and response to outbreaks. Two is to understand resource management in a public health emergency. Three will to be discussed the management of temperature sensitive logistics. And finally, to describe the components of an effective logistics management information system, IMS. Next slide. So our goal and objective is that this lesson will introduce the definition, concepts, and principle of resource management. Objectives being, recite the definition of resource management, list the 4 resource management tasks, list the resource management concept, and list the 5 principles of resource management. This is for our first topic, which is resource management. Next slide. So primary tasks for resource management. There are 4 tasks for resource management, which includes establishing systems for describing, inventorying, requesting, and tracking resources, activating the system prior to, during, and after an incident. 3, dispatching resource prior to, during, and after an incident. 4, deactivating or recalling resources during and after an incident. Next slide, please. So the concept of resource management is that resource management relies in concepts. And these concepts are standardized identification, allocation and tracking of resources, classification by kind and type of resources required to support incident management, implementation of a credentialing resource tied to uniform training and certification standards. Then finally, incorporated resources from private sector and non-government organizations. Next slide. So we have 5 principles for resource management, and these are advanced planning, resource identification and ordering, resource categorization, use of agreements, effective management. Next slide. So what are the resource managements during incident? So getting the right resources to the right place at the right time can be a matter of death, can be a matter of life and death. So the resources that we have to prepare during incidents are personnel, equipment, supplies, and facilities. So this is the cycle and steps of resource managing. There are 7 steps, including identify requirements, order and acquire, mobilize, track and report, recover and to mobilize. Step 6 is to reimburse and inventory. Next slide. So I will go slowly by explaining more on each step. The first step is to identify requirements. So operation sector identifies, refines, and validates resource requirements. And this process includes identifying what and how much is needed, where and when it is needed, who will be receiving or using it. Then the second step will be, next slide please, order and acquire. So the logistics section has a standardized resource ordering procedures used when request for resources from operations of IMF staff when IMF staff cannot be fulfilled. Next slide. The next step is mobilize. Plan sections ensure incident resources are mobilized as soon as they are notified through established channel. Mobilize notification should include the date, time, and place of departure, mode of transportation to the incident, estimated date and time of arrival, reporting location, assignment, and duration. Then finally, applicable. I can't see exactly my notes. Next slide, please. Applicable cost and fund code. Next slide. So the first step is track and report. So the logistics section tracks resources in a standardized integrated process conducted prior to, during, and after an incident too. So this includes provide a clear picture of where resources are located, help staff prepare to receive resources, protect the safety and security of personnel, equipment, and supplies, then enable resources coordination and movement. Next slide. The 5th step talks about recover and demobilize. The recover and demobilize step involve the final disposition of all resources. And during this process, resources are rehabilitated, replenished, disposed of, or are retrograded. Demobilization is the orderly, safe, and efficient return of an incident resource to its original location and status. Demobilization planning should begin as soon as possible to facilitate accountability of the resources. Step number 6 is reimburse. Finance and administration sector controls the reimbursement mechanism to recoup funds spent for incident-specific activities. Reimbursement includes the following activities: collecting bills and documents, validating costs against the scope of work, ensuring proper authorities are secured, and using proper procured form. Step number 7 talks about inventory. So the logistics section is responsible for inventory system use to maintain current data on the availability of resources. And this data includes information on credentialing and resource typing. Inventory system for resources management should be adaptable and scalable. Then we will go to our last topic of today, which is resource typing and readiness. And the overview is that we have to define the goal, which is to introduce the concept and application of resource typing. And our objectives being define and explain the importance of resource typing. Number 2 is to describe the benefits of typing definitions. Then number 3 is demonstrate resource typing by category, kind, and type. Objective number 4 is to identify the 3 components used to assist in resource typing. Resource typing and readiness. Emergency management and incident response activities require that resources like personnel, teams, facilities, equipment, and/or supplies are prepared to meet incident needs. Utilization of resource typing facilitates the efficient and effective deployment of resources, both human and material. So resource typing is the categorization by capability of the resources required, deployed, and used in incident. Assigning a standardized typing designation to each resource allow incident manager to request and deploy resources. It is essential to inventory and maintain current data on available resources. Next slide. Credentialing includes 4 elements. These are education, training, licensure, certification, and experience. Next slide. Resource typing, kind, and type. Information system resource are categorized by kind, which describes what the resource is, type, which describes the size, capability, and staffing qualifications of a specific kind of resource. Next slide. So these are the steps in resource typing, which is resource, kind, and type. Kind refers to broad classes of the characterized similar resources such as teams, equipment, supplies, vehicles, and aircraft. Type specifically defines the level of capability. It may vary by power, size, or capacity, and ensures incident manager requests, receives, and deploy the resources needed. Next slide. Here we compare type and kind. So an ambulance is a kind of resource, and type is the ambulance specific specifications like type 1, type 2, type 3, which includes the size and capability based on life support, advanced life support, and other things. The definition of typing, next slide. Because resource typing provides information about resources, capability, emergency managers, and others know the capability required for a requested resource to respond efficiently and effectively. The development of typed resources supports the establishment of 1. Comprehensive national mutual aid and assistance agreement, resource management and tracking systems. Components of resource typing. To conduct resource typing, logistics examine the public health emergency operation centers resources to identify the capabilities of the following 4 resources components, which are information management system, equipment preparedness, interoperability, standard operating procedures. IMS system are used to collect data and process data, to track resources, display resources readiness status. And next slide, we talk about equipment preparedness. So critical components of equipment preparedness include acquiring equipment that will perform to certain standards, including interoperability with other organizations, and developing a common understanding of the abilities of distinct types of equipment. Next slide. Interoperability. Emergency communication systems should be tested, be the same or linked to the same system used for non-emergency procedures, effectively interface with the national standards, allow data sharing among key players. Then we'll talk about SOPs. Mutual aid and assistance partners should coordinate SOPs describing how a resource can be deployed, agree on policies where possible. Then finally, I'll just have a recap on the summary of these 2 topics. So resource management tasks are establishing systems for describing, inventorying, requesting, and tracking resources, activating the system prior to, during, and after an incident, dispatching resources prior to, during, and after an incident, deactivating or recalling resources during or after an incident. And 5 key principles of resource management we have initially captured, but again, I'll talk to it since it's a summary. So 1 is advanced planning. The 2nd is resource identification and ordering. The 3rd is resource categorization, use of agreement, effective management. Then finally, I will summarize on resource typing and readiness. So IMS resources are categorized by kind, which describes what the resource is, and type, which describes the size, capability, and staffing qualifications of a specific kind of resource. So to conduct resource typing, logistics examines the public health emergency operation centers resources to identify the capabilities of the 4 components, which are information management system, equipment preparedness, interoperability, and standard operating procedures. Thank you. That has been my presentation for today.
Thank you very much, Nolin, for Nice presentation, really rich. I've been particularly taking a lot of notes, as many of those aspects were really new to me. Thanks a lot for this great presentation. Just again to remind everybody, please use the Q&A box and submit the questions you have, the comments, if you have experience you would like to share with everyone here. I think we are at the right place. Don't hesitate to do that. Abdi Rashid Mohammed is raising the hand. I am wondering if our colleagues from the Africa CDC are able to give the mic to Abdi Rashid Mohammed for asking his question. Chimwemwe, Womi from the Africa CDC side, is it possible for you to please unmute Abdi Rashid Mohammed for his question? He will be followed by
Yes.
Awal Tukur.
Yes, my name is Abdurrashid Mohammed Hussein.
Welcome.
Yes, it was very interesting presentation. Thank you. I would like to ask one question. When you're talking about resource, how can I manage if resource limited to do more patients to do COVID? I have less resources.
Personally, I'm not sure if I got the question well. Can you please repeat? I didn't hear you well. Apologies.
Okay.
Thank you. My name is Dr. Abdurrashid Mohammed Hussein. It was really very interesting presentation. I would appreciate the lecturer. I have a simple question for you. Yeah, here in Somalia, we have very less research hospitals in terms of COVID-19 and other infectious diseases also. So how can we work under this very less resource hospitals or clinics? According to your experience, what's your recommendation or what's your comment about that less resource hospitals? Thank you.
Thank you very much, Abdi Rashid Mohammed. I don't know if Felix would like to give an answer to this question about the situation in Somalia, where the main constraint is having limited resources at the health sector. Felix.
Yeah, thank you very much, Yusuf, and thanks very much, Nolin, for the well done presentation. I agree that resources are always scarce, and it's up to logisticians and logistics officers to manage whatever they have to maximize the output of the response. So in Somalia may be one example, but it's a general problem where you have to respond and the needs are huge and the resources are limited. So following the process that Nolina has articulated for us is very, very key. So first of things, if you're responding to COVID, or any other incident, planning is key. If you plan to test this number of people, if you plan to deploy this number of staff to different locations, then the details, the logistics details, as Noreen has articulated right now, have to be in detail examined and look at what can be done using the resources we have. You may want to go to the resource typing and readiness she presented, where you may enter an agreement for with some donors, and where you may even look at being more stringent, putting more SOPs on how people get the resources, how do they use them or reuse them, how do they, all that process that has been presented, in my understanding, and maybe other panelists will add, have to be followed and look at what can be maximized using the little resources that are available for the team responding to the incident, for the region or for the country that's responding to the incident. COVID being one example of the incidents we're discussing now. I submit for now. Other panelists may want to add something.
Thank you very much, Felix. I really appreciate your comments, and one key term you have used is optimizing the use of the resources, and I think that's crucial to make sure we adjust our needs to the level of resources that are available in our hands. I think that's really important, and my personal opinion will be also, when it comes to resource mapping, I think having a multi-sectoral approach to resource mapping, a multi-sectoral approach to resource identification could be something very helpful, as we may realize that we have more resources than we really think if we are able to bring around the table different stakeholders and try to understand who can provide what, when, and at which stage. Any addition to that from your side?
I would like to add on that.
Nolin.
So, for you to have a good management system when you have limited resources, is to decide what you need to do first. Yeah, you have to prioritize. Decide what you need your attention and direct your attention to urgently needed things to be done, and be decisive and also realistic on your decisions. If that project that you've selected will really deliver results, then you should go with it, so that you can eliminate other projects that are costly and they are not going to be productive by the end of the mission or the tasks, you know? So you have to free up resources and also find other more productive ventures. That's all from me.
Thank you very much, Nolin. That's really important. Prioritizing the use of the resource. So I hope our colleague Mohammed, Abdi Rashid Mohammed, could get some out of this discussion, some response element to his question. The next hand I was mentioning, I don't see it anymore. There's Frederic Morelli who has a question, please. Frederic. If Frederic is not ready, Adamu. Frederic, the floor is yours, please.
You can hear me?
Yes, we can hear you loud and clear.
Thank you, Yusuf. Let me first appreciate the presentation made by my colleague there. It was such a very, very interesting presentation. I don't have really a question. What I really wanted to ask, if the the presentation she was making, if we can get the PDF copy so that we can go through it during our free time, we can continue reading and sharing. That's really what I really wanted to ask. If we can get the PDF copy.
Thank you, Frederick. That's a great question. I think one of the objectives of this webinar is to encourage and facilitate knowledge sharing across countries, regions, between our network, within our network of experts and EOC professionals. So we have made the Discord platform available to you. You can have access to all the materials since we started the webinar. The Discord platform is being updated. You can download whatever materials that has been presented here.
Thank you.
Read it whenever you have time. So, and feel free to share it in your network also, and encourage more people to join us for experience sharing. Thank you. Adamu, question for you, or Stanley? If Adamu is not yet ready, we move on with the next person. Stanley, if you are available to take the floor, otherwise, Yakub, the mic is yours. Yakub Khalif.
This is Stanley.
Stanley, okay, go ahead, please.
Yeah, many thanks to the presenters and you moderators for today's session. It has really been very, very, very wonderful presentation. Just my quick one is, what is the role of CDC or the guidance of CDC Africa in the current distribution of COVID virus vaccines under COVAX mechanism? And of course, other related supplies in response to COVID. And maybe the second one, just from resource mapping, is there plans underway maybe to conduct either at regional level or country-specific level some resource mapping exercise to see the levels of resource currently at the country level? Thank you.
Thank you very much, Stanley. Felix, any comment about these two questions? First one is about if there's a guidance of Africa CDC for COVID vaccine distribution, if I get it well. The second one is if there's a plan for resource mapping that could be customized for country use, for example.
Yeah, thank you very much. It's a brilliant question. They are brilliant questions. On the first one, Africa CDC, in collaboration with different partners, with the World Health Organization, WHO, with other different partners, has been leading the response to COVID-19 pandemic in Africa, and vaccines are part of the response. So guidance or what Africa is doing in collaboration with all the other partners is spearheading the response, as I just mentioned. This including, there are many initiatives. The one was PACT, Partnership for Vaccination Testing, where we have to trace, to test, to trace, and treat. So now when it comes to treat, now we are talking about prevent and vaccinate. So Africa CDC, it's an institution of the African Union, and under the leadership of the African Union, there have been many initiatives to avail vaccines, COVID-19 vaccines to Africa, led by His Excellency Cyril Ramaphosa, the President of South Africa, and now the champion of the COVID response, who has created different teams. You may be aware of the vaccine, Africa Vaccine Acquisition Task team, AVAT, which has been trying to secure doses needed for Africa in order to be able to vaccinate 60% of that the adult population by end of 2022. So AVAT has been one of the initiatives to get access to these vaccines. Then there is another team called AVDA, which is the Africa Vaccine Delivery Alliance, that has called all partners that deal with logistics, with vaccines, manufacturers, and others, to make sure that should the vaccines be secured, then they can be the end-to-end supply chain is maintained, and the cold chain as well is maintained. So AFDA has been also working around the clock to make sure that the vaccines move across the continent. But also Africa CDC has been advising countries to that have entered into bilateral agreements with manufacturers and has been working with these countries to make sure that what goes in country can be managed in terms of logistics, and can be properly used, limiting the wastage to a bare minimum. So there have been a lot of guidance, a lot of discussions with African countries, member states, with different organizations. I've mentioned WHO, but others like WFP, like UNICEF, working also with the COVAX facility that you are aware of, so that the delivery of the vaccines are streamlined, are coordinated. I mean, the deliveries are coordinated and streamlined. This is the first part of the question, and I invite
the second one was about if there's a customizable plan that is made available for resource mapping for countries, for example.
So thank you very much. With the COVAX and with the Africa CDC as well, there have been some checklists that have been developed and shared to understand the capacities in terms of logistics of different countries. Because the thing would be, if you send, let's say, 1 million doses of vaccines to a country like Kenya, for instance, and the cold chain capacity is maybe 800,000 at a time, then you may lose the 200 doses. So there have been a checklist to ensure, I mean, to map out the capacities of different countries, and take that capacity, that mapping, to coordinate the deliveries of the vaccines when shipments are being planned, and when deliveries are being discussed with the different partners I've mentioned. So it's not a one size fits all template, but there are some templates that have been developed both by Africa CDC and by COVAX. I don't know about other partners, but those tools can be used by different countries to map out the capacities and plan their logistics, both for vaccines and ancillary products as well. Submit for now to let others who may have a comment to do so. Thank you.
Thank you very much. And it will be very helpful if you can also share some of those links on the Discord platform for our colleagues like Stanley to have a look at and see if it's something that could be useful for his country. The session is very interactive. We have a lot of questions in the Q&A box, and several hands are raised. Just to come back to the Q&A, there's a question I would like to address, to be addressed by Nolin. It's about the possible challenges that we may face when we try to maintain interoperability. Do you have some example of those challenges that we have to go through when we are maintaining interoperability. Some common challenges, for example, if Felix is also having some ideas about those possible challenges one may face in maintaining interoperability.
So some challenges can be lack of consistency, you know?
Yes. And that's really relevant, huh? That's very key. Yes, go ahead, please.
Okay, so, and also other challenges can be lack of standards for sending, receiving, and managing health items, medical supplies. The difficulties with measuring and analyzing to improve interoperability between health systems. These are some of the challenges that I have.
These are great points, really. Thank you very much. Any addition, Felix, before we move back to the people who are raising their hands?
Yes, interoperability is very key, as Noreen has just said, and as you recall in the presentation, we Noreen say that especially for communication systems have to be tested, and they have to be the same or linked to the same system. For instance, you are managing a public health emergency operating center, and you already have, let's say, a system you are using. Some use PHEOC, for instance, and other have other systems they may be using. So now, for a particular incident, for a particular response to an event, if you want to maintain, for instance, the toll-free number, or if you want to bring about a new system for evidence-based, for instance, self-surveillance, what you are proposing, because all these systems, you as logisticians, you be the people who will be contacted to avail them and to test them, I mean, to put them on board in the response. So they have to be tested. If you are trying a new system for a toll-free number, or a new system to send out the notifications, alerts, for instance, then what you are bringing as a new system has to be to match, or to be able to work with what you already have in place and in use, so that the new system you are using for the response can serve the already existing system that you are using, and this, I mean, when you say interoperability can be really very vast. One thing is, if you are, for instance, buying cameras, for instance, and you you are putting something to help you in community engagement. All this, I mean, how the systems you are trying to build or to bring in the response work together with what other partners or your internal systems are already using, checking that, ensuring that they're interoperable. I mean, they have that interoperability is very key. It's very key. Otherwise, that's why we say you have to make sure that they are tested and they can be linked to the systems that are used for the emergency and non-emergency procedures. I submit for now. Thanks.
Thank you very much. Yeah, indeed, a very key aspect, interoperability. I think without it, we cannot exchange information and resources across different partners, network or systems. Another question is, how do you replenish after the resource have been demobilized?
I may go first, maybe Nolin will complement.
Yes, Felix,
So,
please.
For instance, when you've set up a response and it's now the time to demobilize, there are many things you may demobilize, and some of those you may even replenish. For instance, you've set up an ad hoc vaccination center or an ad hoc sleeping tent. Then it's time, I mean, the response is over and you have to, or you have even deployed some of your some of your medicine from the stockpile system. Then the response is over and you are pulling out the teams to go in the other mode, to return, to return from the response mode. So if, for instance, you've touched some of the stockpiles, medicines or equipment, now that the response is over, it's time to see what have you used in stockpile that have to be replaced, and now replenish the stocks for any other future outbreak or any other future incident that may require the same resource that you've used during the response. That's an example. And it's when you demobilize, you return things to their places, and the teams return to their normal works, and the things that you have used in the response, you may now pull them to organize them and for use or storage. Then for those who have been used and need to be replenished, it's time also to replenish. I think this is what was mentioned in the presentation, but examples are many. Over.
Thank you very much. Thank you. Esther Nakazi. Esther, if you're around, I've seen your hand raised since some time. Please take the mic, Esther. If Esther is not ready, then Benedicta, please. Benedicta Boama.
Hi.
Hi, Benedicta.
I hope I'm audible.
Yes, we can hear you. Not very clear, but we can hear you.
Okay. Can I proceed?
Yes, please.
During the presentation with the summary for resource management, it was stated with the text that in establishing systems, there's a description, inventory, requisition, and tracking resources. My question here is, what happens when there's a break in tracking resources for a major incident? Let's say it could be there's a mass disaster like a tsunami, an earthquake, a volcanic eruption. How then would you be able to track all these resources during this time? Wouldn't there be a break? That's my question.
Thank you very much.
You're
any
welcome.
idea about that? Any experience from you, Felix and Nolin? When there's a break in the tracking, if I get it well, Benedicta.
Yes. I meant that when there's a break in tracking resources during an incident, like major mass incident, let's say there's a disaster, a volcanic eruption,
Yes.
tsunami, earthquakes, and all those things, when they come into play, how do you track these resources under the tax for resource management?
That's a big question.
Yes, it's a brilliant one. Brilliant one.
Thank you.
Thanks, Benedicta, for the question.
Thank you.
So ideally, there are things we talk about when we plan a response, when we plan a response, but incidents are different. Events can be as catastrophic as what you described, where everything is disrupted and you are no longer able to for a particular place to do the track and report uh, as as planned. So if you recall what has been presented, in the tracking of resources, you have to provide a clear picture of where resources are located. That's the first step when you are tracking. Now, you have, for instance, I sorry for the people from Equatorial Guinea if I use this example. For instance, you have the resources in Bata, and then there is what happened like 2 months ago where there was explosion. There were explosions, and the resources you can no longer track them. So this it's an incident in itself. So you have the resources that you are using to respond to an outbreak, let's say COVID-19, and those resources were located at a place, and then something happens, you can no longer track that. So I think this is something that you may want to manage at I mean you as an incident manager or as a logistician in the logistics section, then things can be managed case by case according to what has been the issue and how can we go about that. So if, for instance, in the clear picture where resources are located, you have other places that are more accessible and quickly accessible, then that could be a go-to solution. And in the second part of the track and report of resources is to help staff prepare to receive resources and to protect safety and security of personnel, equipment, and supplies. So as you handle the incident that has disrupted the tracking and the reporting of the resources, then you return to the basics and now go to enhance these measures that have to be put in place to be able to track and report resources adequately. Then you enhance in the protection and you enhance the safety and security of these supplies, equipment, and personnel. And you work with the different partners you have under the coordination of different authorities. If the incident manager of the event you are previously managing, or if there is the incident manager of the event that now has disrupted the response, you work with them to coordinate the movement and acquisition of other resources needed for such an incident. So to put it briefly, I think management has to be done case by case, and logisticians and logistics officers have to be involved and quickly act to resolve the issue as soon as possible. Over.
So meaning it's part of your standard operating policies for every PHEOC kind of incident, right?
So I don't know if I captured the intervention, but the SOPs are there. We are talking about the PHEOC. So these are already kind of an SOP or something that can be defined as that. But what I'm trying to say is sometimes you have an event that goes beyond your plans, or that strikes unexpectedly, and you have to manage case by case. But you have to have something as an SOP, as we say, to refer to say, normally the tracking and reporting follows these steps that we are presented. Then you accommodate and try to resolve the issue that has struck and has disrupted the response.
Okay, thank you.
Thank you very much to Benedicta and to Felix.
You're most welcome.
Thank you. I think the discussion is really active and engaging. So unfortunately, the time is also running against us. I will suggest we take one additional question, one last question before we close the session. And if Joseph Polak is able to quickly take the mic for 30 seconds and ask the question, please, Joseph.
Hello, can you hear me?
Yes, we can hear you, Joseph. Welcome.
Oh, thank you very much. The question I wanted to ask was what goes into the credentialing process exactly? So what does it take to credential human resources as suppliers of various goods and services? For example, including also advisory like policy or technical services.
Thank you, Joseph. Nolin, any reaction to this question?
Can you repeat the question?
Sure thing. First of all, thanks for the great presentation. It was really clear. It was specifically about the slide about credentialing. I saw the process there, but I was wondering what exactly goes into that process in terms of the credentialing process. So say someone wants to offer any logistics service or even consulting. I guess they should follow a credentialing process for either bids or responding to needs. And so I wanted to ask, what exactly is that process beyond the looking at education or certifications?
Good. I see there are two questions. If the time is not enough, Joseph, we invite you to also type in these questions in the Q&A. And next week, Tuesday, we'll make sure the experts are available to go through them. Nolin, any quick, short feedback to that before we close the session, please?
I'll pass over to Felix.
Felix.
For now. Yes.
Yes, thank you very much, and it's a very good and practical question. What does credentialing? How does it come in this discussion? So when you talk about resource typing, we say that in the resources there are personnel, there are supplies, there are equipment, and especially when we talk about credentialing, we are talking about personnel. So for you to have a better, an effective response, you need to have the right people at the right place, and these people have to be really up to the task. So the credentialing goes especially to this personnel component of the resources, where you have to make sure that the personnel you have, they are well educated, they're well trained, they have certificate. I mean, they are allowed to conduct such activities they are conducting during the response, and ideally they have the experience they have experience to respond to such incidents. So in brief, this goes to a personnel, to the people who are involved in the response, and they have to be really to get the credentialing process which entails all the 5 or 6 points that Noreen has shared, and this is important for an effective response to have them be ready and right at the point of need. Thank you.
Thank you very much, Felix. Thank you to Nolin and all the participants. I think we are now a bit constrained by the time. So I was really happy to have this discussion with you. As I have mentioned at the beginning, the resources are never enough, and the need for resources are endless throughout the response. So, it was really great to hear from all of you through the Q&A and through the live discussion we had. I would, at this stage, suggest we close the session here, and hopefully we will meet next week again to continue with this webinar series, still in the discussions about logistics and resources management during emergency response, but also during the other phases, including preparedness, right? Good. So I would say thank you to everyone. Next week, Tuesday, our expert will be on board on the Discord platform to answer your questions, the questions we couldn't address here. And we hope you have enjoyed the day, the session, and we also hope we are going to see you next time. Feel free to share and advertise this webinar within your professional network and encourage more and more colleagues to join us. So thank you very much, and see you next week, same time, same place. Have a good day, good evening, good night, according to your time zone. Bye.
Bye.
Thank you. Bye-bye.
Bye. Thank you very much.
Bye-bye.